Hi everybody, this is Corey Goldberg. I have a practice that includes a lot of facelifts, and I often get asked by my facelift patients a bit about how the facelift procedure is done. So facelift, generally speaking, involves some deeper work on the inside. The surgery will start once the patient has anesthesia and is either asleep or has local anesthetic or some combination of both. And at that point, the incisions around the ear and up into the temple or the back of the head are made as needed, as indicated. Once the incisions are made, the skin is lifted, and that allows visualization of the structures underneath. Those structures are the muscles and fiber tissues of the face. That's the SMAS, the SMAS, the superficial musculoaponeurotic system. Once those muscles are identified, the areas that need to be tightened or lifted are marked. Sometimes this involves lifting some of the muscle in the neck to get underneath it, to release it. Once those tissues are identified and released appropriately, they're lifted and tightened and stitched in place. Now the stitches can be dissolvable or non. I generally favor non-dissolving. I generally favor dissolving stitches rather. I find that non-dissolving stitches, I've had some patients from other surgeons that have come back to me and had knots and things that they can feel. So I much prefer to use dissolving stitches, which give the exact same results without having that risk. Once the tissue has been tightened on the inside and things are lifted, then the extra skin is very easy to trim off and remove, and then everything is stitched closed and a dressing is put on. That's the general way that a facelift is done. Of course, this varies a little bit depending on the type of facelift and the type of incisions that are planned, and that's something to talk about with your surgeon to make sure that your facelift is tailored to your specific needs. Wishing you all the best and hope to see you soon.